Um, Hello everyone. Welcome to the afternoon session of the wonderful event we're having today. Next guest is going to be a seasoned prof, surgery, but also ethics. We're going to be having the esteemed pleasure of listening to Professor Rodolfo. But before we go there, I would like to introduce myself. I'm Dr. Daniel David Otobo, and I'm going. So, without further ado, and that we might be according to time, I'll be introducing Professor Rodolfo. Um, Professor Rodolfo Oviedo is a globally recognized surgeon, educator, and leader in robotic and bariatric surgery. He serves as a medical director of and regional medical director for the Piney Woods region, SHSU.com. In addition, Prof. Oviedo contributes to academic publishing as deputy editor of the Journal of Robotic Surgery and associate editor of Obesity Surgery, advancing ethics, leadership, and innovation in global surgical practices. With such a sophisticated and robust experience, we should be very privileged and happy to listen to such a seasoned innovator in surgery. Please, Professor Rodolfo, are you with us?
Thank you so much, Dr. Togo. It's a pleasure to be here, and thank you very much to TORG. It's such a privilege for me. I have been waiting for this event for a very long time, and my heart goes out to you. And I really wish I were with you in person, but I'm with you in spirit. And hopefully next year, I will be there in person. It'll be a dream come true for me. So thank you so much. Um,
You
I
are
am
most
going
welcome.
to, thank you very much. I'm going to share my presentation. Please
That's fine.
confirm in just a minute. Let me know if you can see it. Can you see my presentation?
Is loading. Yes, perfectly.
Okay, perfect. So,
Please, the floor
well,
is yours.
okay, wonderful. Well, thank you so much. So, the topic for my lecture is ethics and leadership in global surgery. And I have no disclosures related to industry to make. My special gratitude and acknowledgement goes to Ambassador Professor Dr. Adebusola Obokole, who is a dear friend. I have come to respect her and I admire everything she has done for TORG. And now she's an outstanding leader at TROX. I'll be talking about that at the end of my lecture. Thank you so much, Ambassador Professor Obokole, for everything that you do for TROX, for your family as well. So for those of you who are here with me virtually or those who have visited as part of our intercontinental training program, you can see these instruments toward the back. This is my coat of arms. These are laparoscopic instruments. And these instruments are articulating instruments. They're laparoscopic, they're not robotic, but if you were to look at them on the screen, you would think that these are robotic instruments because of the way that they articulate, the way they move. And so I'm very passionate about minimally invasive surgery, robotics, but today we're not going to talk about that specifically because in a world where technology encompasses everything that we do, in the digital area, when AI is our assistant, there is an AI assistant secretary here in this meeting that will give me a summary of my talk later. In a world where so much technology is surrounding us, including robotics and laparoscopy, let's talk about the elephant in the room, the uncomfortable question. In a world where science seems to drive everything that we do, we tend to forget our humanity. We tend to forget our values and our ethics sometimes when that gets blurred with so much interaction with industry and with so much technology. This is an example of what the world looks like. There is a pandemic that sometimes we don't talk about, and it's the obesity pandemic, with all the associated diseases that affect patients who suffer from severe obesity. An example is this publication from an incredible research group that I'm a part of that published on the global burden of metabolic diseases from 1990 to 2021. This tells you the status of the world population now. And in the past, maybe the last century, 2 centuries ago, more people were dying from diseases related to malnutrition, for example. And now more patients are dying from diseases related to obesity, such as diabetes, such as heart disease, stroke, and so many others, including cancer. So, is being an academic surgeon worth the effort nowadays? And this talk is geared towards healthcare professionals, not just surgeons, but I'm going to talk about it from my perspective. Is it worth the effort? Is how to remain an ethical leader in global surgery? And how do we do it? Do we do it for our patients, for our students, for ourselves? This is a very brief video that was made for a recent talk I gave on this topic, very similar, and it was led by a leading journal. I'd like to play it just for a minute so that we can talk about the next topic, which is ethics in global surgery.
Prof, we can't hear the video, please.
Okay, thank you. So the video is mostly to show you that this was a webinar on an academic surgeon's career. But at the end of the day, is it really about academics or is it about serving humanity? And I pose the question and I challenge everyone to think, is it really worth developing ourselves all the way to becoming academic surgeons or healthcare professionals? Or should we develop ourselves into being better human beings to serve humanity, to serve mankind? And in the process, we can always try to train as much as we can and become academic surgeons. So, in other words, building ourselves as people who serve each other should be the example to follow. And then everything else adds up on top of that. So my objectives are to discuss the core elements for healthcare for a healthcare student, trainee, or graduated professional to become a successful, compassionate, and accomplished educator and leader, to illustrate the different career pathways for surgeons, for example, but for healthcare professionals, to delineate the principles behind the mental, emotional, and physical well-being necessary for a leader to avoid burnout and depression, to remain resilient, and to reconcile the most relevant and current issues in ethics and global surgery nowadays. Disclaimer, these examples are lessons from my own mistakes and successes, and they're from my mentor's wisdom passed on to me. Their purpose is to illustrate what I have learned since I graduated. They're not meant to focus on my achievements, but to inspire others to do greater things. There was an essay when I was a chief resident. I invite everyone to read it, and it's a very personal essay for me. There was a competition when I was a chief resident in Houston in residency, and this essay won the first place. And I mention it because it talks about two human beings who inspired me to be doctors, and I have learned from them much more on how to be a doctor compared to what I have read on books or on journals or manuscripts. And these are my parents. I invite everyone to read this essay. It talks about their testimony of life, how they inspired me to be a doctor. They never told me to become a doctor. I just did it because it was my calling. But at the same time, I have learned about their humanity and how they treat patients. And I invite everyone to read it. And it's called With Actions, Not Just With Words. And I have left the reference at the bottom. These are my parents. This is when I was born, of course, and these are my parents the day I graduated from residency. And these are my parents the day I was invested as a fellow of the International College of Surgeons in San Antonio, Texas. It was a wonderful opportunity for me to share it with them. And I acknowledge them as well because of everything I have learned on being a doctor from them. So my journey takes me from the Florida State University in Tallahassee, Florida, all the way to Miami when I did fellowship training, then to the woods and forests of Virginia, all the way to San Antonio again for practice. and then from San Antonio to Houston, the fourth largest city in the United States, and then to beautiful Nacogdoches, Texas, where all of you are most invited to come and visit us as part of the Intercontinental Training Program from TROGS. And this is me as a chief resident performing my last case. If you look at this organ, you would think it's a liver, but it is not a liver. It's actually a spleen from a patient who suffered from lymphoma. And this is a Whipple procedure specimen. You can see the head of the pancreas with the suture marking the common bile duct. You can see the duodenum in anatomical orientation and the first portion of the jejunum. This is a Whipple procedure that I performed as an attending or consultant surgeon already at the beginning of my career. And why do I show you this? Because I show it because it's very important to retain our values and what we have learned in residency and training, but at the same time, it's even more important to retain our humanity and our ethical principles. So is being an academic surgeon worth the effort? How to remain an ethical leader in global surgery? Well, if this is for you, if you're thinking about becoming a global leader, well, yes, it is worth it, but it is not all about academics. It's about retaining our humanity on the journey and becoming an ethical leader through service and selflessness. An example of this is what you're doing with TORG, with the Operating Room Global, and with societies such as TRUGS, which is a sister society to TORG. You can continue to grow as a human being, and you can increase your chances of becoming a global leader by serving others and by putting your talents to the service of humanity. The three A's are what I learned from Dr. Skilling when I was a young consultant surgeon. You need to be affable, able, and available. In other words, if you have those three features, those three virtues, if you cultivate them, you're going to do a great job as a surgeon or as a healthcare professional. You're affable, able, and available. You're going to take care of your patients well. They will thank you, and the other doctors who consult you for their patients' problems will be very thankful to you as well. What else does a leader need to be? A leader need to be dynamic. You need to reinvent yourself. You need to evolve with energy and enthusiasm. Never get stuck. Always move forward. Think outside the box. Learn from others. You're not the only one with the solution. Learn to be very humble. Learn how to capture the knowledge from other people and work together to solve problems. You need to be a leaf carried by the wind. This is an example. For example, I have been training a lot throughout the last decade. This is an example when I went to a conference, and then there was an industry truck training surgeons on how to perform endoscopic suturing. I took advantage of the situation. I went there. I walked for several miles to go to that truck and learn and get my training done. Do whatever it takes to train, but at the same time, do everything that you can to retain your humanity and be compassionate. You need to be passionate about what you do. If you need to educate patients, educate other consultants on what you do, attend tumor boards, grant rounds, meet your colleagues, do everything that you do to promote your career as well, of course. Selfless and empathetic. This is an example of an essay that I once wrote when I was a third-year medical student, talking about it's interesting how you can decrease the rate of lawsuits. And in the United States, we do have a lot of lawsuits, and we're not the only country with that related to healthcare. So it's very important to maintain our communication with family members. We will all get complications. There will be complications with everything that we do, but it's very important to maintain our communication with the family members to make sure that we're always available, but we're never hiding from them. It's very important. And we learn based on research that has already been published that you can get complications, but patients will not take you to court if you maintain communication with them. They're less likely to sue you. On the contrary, if you disappear, if you don't give explanations, if you don't recognize that something went wrong, it is very likely that they will sue you. And of course, we don't do it because of fear of lawsuits. We do it because it's the right thing to do. We need to remain humble. We need to go back to our first love, which is medicine and surgery in my case. Remember our oath and our calling. We need to recover from complications and mortality as well, and learn what we have learned. We need to implement it to help other patients and avoid that in the future. We need to be confident and empathetic. Thank your surgical technologists. Thank your OR staff. Thank your nurses. Be grateful to everyone. These are just pictures from different staff, hospital staff that have helped me throughout my career as I continue to progress and evolve as a surgeon. We need to learn from errors. That builds character and confidence. Learn from our nurses, listen to them, learn from our colleagues, learn from everybody, including our patients. Remember that learning leads to experience and experience leads to confidence. For example, this is an example of a problem. I had a patient with a complication, but I got that experience. That experience, I turned it into an opportunity for learning, not only for me, but for other surgeons. And I presented that as a video case report at the American College of Surgeons Clinical Congress 2019 in San Francisco. So that was an example of what we did, and it was already published. So an example of how you can take something bad and turn it into something good for the good of mankind, for the good of your fellow surgeons and healthcare professionals and your patients. You also need to be wise, and it's very difficult, but it's doable. Learn from other people, from your mentors. This is my mentor in the middle. Rest in peace. He passed away already, but he was a wonderful human being, wonderful surgeon, a gifted teacher, and he taught me so much of what I know now based on hepatopancreatic or biliary surgery and GI surgery. We need to know when to ask for help. We need to have mentors, and that's why TROX and TORG both have mentorship programs, and we have senior surgeons and partners who will be able to, in a second, they'll be able to respond and answer your questions and help you and guide you based on their experience. We need to be patient advocates. There was a campaign from the American Cancer Society, 80 by 2018, meaning 80% screening rates with colonoscopy by 2018. So I was the physician champion for the American Cancer Society in my hospital in Florida to be able to offer colonoscopy, free colonoscopy to patients who did not have resources to pay for that in underserved rural populations of Florida. So this is an example of what you can do as a doctor or as a healthcare professional to advocate for your patients and convince administration that this is the right thing to do. So a global leader is always a patient advocate. It cannot be something different. A global leader is a team player and a builder. Educate and train your team, promote your students' accomplishments. The role of a mentor is really to form the future, to contribute to the formation and forging the future of the mentees so that the mentees will surpass the mentor. My dream is for my mentees to get better, become better than I am, because then, of course, my legacy will live on in everything that they do. And so I always try to make sure that my mentees become better doctors, better surgeons than I am. And that actually makes me very proud. So we must try to do that. We must try to pass on the legacy and form the new generation of leaders. Team player, builder, these are examples of how I'm working with my team on establishing robotic programs in different parts of the United States. These are examples of drawings that I made based on real cases that then we presented together at different congresses. These are just examples of what we do at TRUX as well. These are just some of my mentees throughout the years. Many of them are senior residents. Some of them are already surgeons in practice. I am extremely proud of them. And honestly, it's like having your own children, watching them grow and being very proud of them as a father or as a big brother as well. Innovation is important. A global leader needs to be an innovator, and always develop your niche. Make sure that whether it's robotic surgery, laparoscopic surgery, endoscopy, abdominal wall reconstruction, all of these aspects, pick something that you're really good at and you're passionate about and try to develop it and try to distinguish yourself that way. Because when you're in a position, when you're a leader in a specific field, then you can influence others for good. And then you can establish pathways for mentorship and education. So if you pick a career in which you develop your specialty area, you can then use that as a platform so that you can educate others and serve humanity with global surgery, such as what is done with TORG or TRUX. These are examples of difficult cases that I did, like stenting for leaks, for GI leaks, bariatric surgery, difficult cases that went very well. Then we present them, we publish manuscripts, we attract the attention from young, talented medical students and residents who want to be like us, and then who end up being better than us, and then who become members of TRUX or TORG, and they can continue the legacy and serve humanity. I don't want to take a lot of time. I know the time is limited and precious, and out of respect to the next speaker, I'm going to speed up now, but this is important. Be an active member of surgical societies. For surgeons, for example, or for nurses or for anesthesiologists, members of TORG, because I know it's not just for surgeons. Be a member of your professional society. Make sure you serve on committees, do as much as you can to serve, and then distinguish yourself as a leader. That's one pathway. Actually, doing the little things, doing them really well, paying attention to detail, fulfilling the expectations, meeting deadlines, working on manuscripts, whatever project they give you, the committee chair gives you, make sure you do your best to carry it out. And you don't have to even advertise it. Just do your job. People are paying attention to you. The leaders are watching you. They will promote you. They will give you more opportunities, and you will become a global leader. Trucks, we're very, very honored that we're one of the few societies in the world, just like TORG, where we give leadership positions to young members, to medical students, even to surgical trainees. We give them leadership positions in committees. We believe that it's very important because you see, the medical student of today will be a doctor tomorrow. And so the difference is just one day, one graduation ceremony. And yes, it takes a lifetime to learn how to be a good doctor. I get that. But at the same time, let's think about the young generation and let's contribute to their formation and the leadership, the new leadership that will carry us further. And maybe one day, just as we have a fellowship of the American College of Surgeons and a fellow of the Royal College of Surgeons, maybe one day we'll have a fellow of trucks. It will be a dream come true. And we're working on that. So you also need to be a historian, keep track of your complications, learn from them, and keep a registry of your cases. It's very, very important to get better. A researcher and a scientist, if you don't have to, but a global leader also distinguishes himself or herself as being a researcher too, because you don't need to be the most experienced researcher in statistical analysis or anything like that, but you do need to have an inquisitive mind. You need to ask a question that is important to your patients and make sure that you come up with solutions and hypotheses to work together with your team. And just to finish, this is an example of publications. We got started with publications with medical students, mentoring them. At one point, this was the largest renal cell carcinoma in the world at one point for a couple of years. And I had the privilege of taking care of this patient. But later on, it's no longer the largest one ever reported, but it's somebody. What matters the most is not the size of the tumor. What matters the most is that the patient did well. The patient was very grateful and gave us permission to publish a case report, of course, while protecting his identity. But this is an example of how we can get involved by mentoring medical students and forging their education so that they can take us further. Examples of publications that we have worked with medical students and with surgical trainees. This is just an example of what we do at Trucks, of course. Collaborator, diplomat, a student of surgery. You need to be a student all the time. You need to continue to learn, take CPD, CME courses, attend meetings such as this wonderful TORG+KFHR 2025 Congress, which is breaking records and is making history. Very proud of you. You need to be a business student. A global leader also is a business student. Somebody who understands the market, understands how to be a diplomat, how to interact, how to negotiate with other societies. A global leader is a student of business administration. And you don't have to have an MBA, a Master of Business Administration, but you need to be a student of everything related to your business. You need to be a communicator. If you need to be on social media, be on social media. If you have to have people supporting you to be on Instagram and TikTok and making educational videos, do it. A leader is always showing their face, is never hiding. A leader is a person who learns how to speak, is a person who learns from others how to communicate. And you are doing a phenomenal job at TORG promoting your leaders that way with communication skills. We're very proud of you. A humanitarian, obviously, this is global surgery. You need to be a humanitarian. You need to be somebody who fights for the goodness in humanity, who still believes in the goodness of humanity, who does not give up on humanity, on compassion, on generosity, on kindness. And we need to be resilient. We need to be able to get stronger with the battles and challenges of everyday life and get stronger. A well-rounded human being. And who do we do it for? Do we do it for our patients? Do we do it for our students or for ourselves? Well, we do it for humanity. We do it to serve with integrity, with selflessness, with love. Just to finish, there are different career pathways. This is beyond the scope of the talk, but you could be a global leader in academics. You could be working for a university or a hospital associated with a university. That's great. Or you could be in a hybrid environment like I am, working for a corporation for profit, but at the same time affiliated with medical schools. So I'm a professor for two medical schools in the Houston, Texas area. And so that's an example of how you can do it as a leader, or you can even do a leadership in private practice. You don't need to be affiliated with academics if you don't want to. But this is an example of when years ago when I was in San Antonio, I used to fly in a little plane from not my plane, of course, the practice owner would send me on a little plane to different cities in Texas to see patients in different practices. And I don't know if you know this, but Texas is a huge state, huge, about the size of Western Europe. And so we would fly to different places. And this is an example of how I would promote leadership by being in private practice for a little while. Now I'm in academics, but it's an example. You don't need to be in one particular area to be a leader. Um, this is an example of resilience. We take a patient with an acute abdomen with a massive bowel edema. We cannot close the abdomen. We do component separation. We do abdominal wall reconstruction, wound vac. The wound closes, the wound heals. An example of resilience, which is the ability of a substance or object to spring back into shape, elasticity, the capacity to recover quickly from difficulties. This is an example of what a leader does. And yes, of course, remember your physical, mental, emotional, spiritual pillars so that you have a healthy life and you can help others achieve the same. And every year, this is very sad, about 400 physicians commit suicide in the United States. That's more than one doctor per day. I don't know if you knew this, but it's very important, extremely important for our patients, for our community to stop this by teaching our students and our trainees how to be resilient, how to remain human, how to avoid burnout and depression. It's extremely important. And this is a paper that I invite you to read. It talks about this very topic. I was one of the co-authors. It's a wonderful paper. It's several pages long, but it's like a book chapter. I invite you to read it to learn about this topic. And finally, a little announcement. TROGS, we're very proud to have developed an educational curriculum. A leader in global surgery also promotes others and works with others as a team member in order to promote surgical education. This is an example of a curriculum that we developed for surgical education with the hashtag surgical education for all, because we believe that everyone in the world deserves the chance to learn about minimally invasive and robotic surgery, not just people or surgeons from developed countries. This is very important for everybody. This is a QR code about the publication. You're welcome to read the manuscript. You're welcome to participate in our study. We're very honored to do that. And we would love to collaborate with our brothers and sisters from the African continent so that they become members of TROGS. We would love to have more members from Africa. It's our dream it would be a dream come true for us. And we would love to collaborate with you in your endeavors and teaching, developing curricula with you, and of course, working with you at IRCAD Africa in beautiful Kigali. So it'd be an honor for us to do that. This is an example of the video where you can use the curriculum that we developed so that you can grade the video. And we're now working on artificial intelligence capabilities so that we can train the AI how to grade surgical proficiency based on the scale that we developed. And this will be leading to publications. Anyone is interested in that, please reach out to me. We'll put you to work in our team. We'll be happy to do that. Finally, this is last. Laboratory for Augmented Surgical Training, when we see many of our intercontinental training program trainees and candidates working on how to build a simulation model with ventilator circuit, on how to perform colonoscopy and endoscopy on ventilator circuit. We're working on multiple models, developing a lab at low cost, and we will publish that. How to build a simulation lab with low cost so that other countries can do the same. We have limited endoscopes. We do laparoscopic suturing. We do endoscopic training. We also do robotic training, simulation training in the OR with Penrose drains. We teach hardware. We teach our students and trainees from the Intercontinental Training Program how to work with the robot, how to learn about the robot. Even if they've never touched a robot, we walk them through it, and they do simulation also. They do operations with simulation, with AI, with artificial intelligence, with virtual reality. And so they're able to learn as much as they can from robotic surgery, and then they go back to their countries and they take that knowledge and they can become leaders themselves in their countries. This is an example of the team from LAST and from the Intercontinental Training Program from TROGS. I invite you to check out our website, trogss.org. Check it out. We have an application. And if anyone is interested in becoming a program director in Africa, please let us know, or anywhere in the world, not only Africa, anywhere. If you have a laparoscopic program, you don't even have to have a robot. You could be a program director if you're passionate about surgical education with us. example of the universities that have affiliations with us. And just to recap, in conclusion, it is possible, feasible, and practical to become a well-rounded physician with an academic surgeon's career, if desired, eventually leading to global leadership. However, the emphasis should always be on becoming compassionate, sincere, and a healthy human being with integrity, dedicated to a life of service locally first, but then eventually globally if the calling is yours. An academic and global leader, as a surgical educator, that career is possible while growing as a professional through networking, such as what you do at TORG or what we do at TRUX, and service in societies with a humanitarian scope and altruistic mission. This is what you do. This is what we do. This is who we are. One global family. So thank you very much. It's been my honor. I wish I could talk for a longer time, but out of respect to the next esteemed speaker, thank you so much. Professor Dr. Otobo, thank you, and thank you, TORG, for the honor.
Thank you so much, Prof. This was so amazing. I was taking notes and paying a lot of attention, and definitely I would be sending you an email very soon on how we can partner more with drugs. Due to the time constraints and trying to move in, not to get into the time of the next speaker, to the audience, please, I'll permit one question, and subsequent questions can be taken after the next speaker, or you can send your questions to the email of Professor Rodolfo. But one question from the audience, you can unmute your mic and ask the question, please. So you can send it into the chat box.
Can I ask?
Yeah, please, s'il vous plaît.
Thank you very much. So thank you, Professor Oviedo. It was phenomenal, and I was just staring and how could a man this much well-rounded? Well, I'm a surgeon too, but how could a man be well-rounded? And sometimes there are like people were saying when I'm staying with these people, I feel very small. They report that kind of thing. So this is, I think, decades of excellence and generous give back. Uh, my question is, whenever it comes to robotic platform, how can we move to the ethical distribution of this robotic platform and training because it is very costly. It's unaffordable, especially in low-income countries, even though the surgeons are very enthusiastic. And even we know that the significance that brings into the patient safety and patient care at all. So how can we can overcome this kind of challenges?
Thank you, doctor. I'm gonna take just a few seconds to answer your question. Thank you so much. I appreciate it, and feel free to reach out to me. I'd love to have a conversation with you, and of course, recruit you to be a member of Trucks. I can see you're a leader, and so how do we do it? It's very interesting. The market is becoming more interesting now. We have other new up and coming startup robotic companies that are making robots that are more compact, that are more versatile, and that are cheaper, and it's getting better. So you may not be able to in other countries to afford the biggest one, the most expensive one, but you could afford the competition. And the robots are becoming so good that you could be cross-trained across multiple platforms. In fact, that's the best way to do it. If you learn how to operate different robots, attend congresses, come to conferences, be a part of trucks. We'll educate everyone. We educate ourselves. We're not only about teaching, we're also about learning together so that we can surgeons educate surgeons. That's one of our hashtags, where industry is one of our partners, but it's not who drives our education. There are other robots that could be affordable in other parts of the world. Let me put it that way. I'll be happy to talk to you later offline, but there are ways to make it happen, and we're working on it at Trucks and establishing simulation centers across the world. So we work with industry so that we can democratize surgical education for all.
Lovely. Thank you so much, Prof. Please, in 30 seconds, one of the audiences, Nurse Aligo, wants to know what programs you have for surgical nurses or perioperative nurses to fit into robotic surgery. Please, in 30 seconds.
In less than 30 seconds, we are working at the leadership at TRUGS to expand the membership, and it's my dream to expand it to allied healthcare professionals, such as nurses and such as surgical technologists. And so it's not only for doctors or medical students or surgical trainees, but it's also for our allied healthcare professionals. It's very important. It has not been approved by the Executive Council, but it's my dream to post it as to post that as an initiative to the Executive Council. We run ourselves as a democracy, so it has to be approved. But I'm working on it, and I'm hoping that it will be approved so that we can increase our membership and help others as well.
Amazing, amazing. Lovely again to have you, Prof. Thank you so much for this opportunity. And thank you for the work that you do and the compassion that you bring to the field. Very important. We are doctors who do surgery. We are not robots. We need compassion. Thank you so much.
Thank you so much, and congratulations on the Congress.
Gracias. Thank you.
Thank you.
Okay, so hello everyone. Going on further with the afternoon session and still on time. It was a lovely session we had right now on ethics and leadership in global surgery, with, of course, a very large eavesdropping into what robotic surgery is, which is, by all means, the future of surgical care. But now we're also moving into the next session. The topic is the journey of a future surgeon, challenges, opportunities, and insights. This is going to be a very insightful conversation given to us by Dr. Raghav Bansal. Dr. Raghav Bansal, who is with us here today, is an amazing physician, a clinical researcher, and surgical educator. He currently works in